Good afternoon and good morning for some of you. I'm Steph Biazzi from Chartwell, and I'll be your host for today's event. Welcome to the second webinar in a series of 4 that we're presenting every Thursday in February. All webinars are at this same time. Today's session is entitled Retirement Living and Aging at Home, Comparing the Health Benefits in the Age of COVID. And I think you're really going to enjoy today's content. Just so you know, we are recording the event, and participants subscribed to our email list will be provided the content after we're done. But stay with us for the Q&A at the end. Just remember to enter any questions into the comment box that you may have. Now I'd like to introduce Amanda Richards from Chartwell. Amanda has been with us for over 15 years in the sector, and she will be taking us through today's presentation. Amanda?
Thank you, Steph. I am so excited to be here today to talk about this very important topic. I'm sure a lot of you right now are weighing the options as to whether now is the right time to make a move to retirement or to seek some additional daily support if perhaps your current living situation isn't really serving your health and wellness needs. To ensure today your experience today is a good one and to avoid any interruptions in Wi-Fi or connectivity, I have pre-recorded the bulk of my presentation for you, which we're going to play now. However, Steph and I are going to be here, so make sure that you submit your questions in the comment box, and we're going to come back live after this presentation to answer all of your questions. So enjoy.
It's amazing to think that it's already been almost a year since this worldwide pandemic began. It's been a difficult year for all of us as we've had to spend so much time away from our family and friends to keep them safe. And I think it's been an especially difficult year for seniors living on their own. If you're a senior, perhaps you're getting out a little bit less, or perhaps you're receiving fewer and fewer visits from family and friends as they're afraid to get you sick. And if you're a caregiver, this time might mean that you've experienced a lot of stress, worrying about your loved one and worrying that they might not be getting everything they need to live well right now. And you might be putting a lot of pressure on yourself to try and figure out how to provide everything they need. I think it's safe to say that we're all sick of this pandemic. The big question is, when will it be over? We wish we had a crystal ball that we could look into that would give us the answer. I think a lot of us are delaying fun things like travel, weddings, or celebrations, big family birthdays or milestones, even welcoming newborn family members. But on the other side of the coin, I also think there's a lot of people out there who may be delaying important decisions like downsizing or moving into a retirement residence until the pandemic is over. I can tell you that at Chartwell, we are feeling optimistic. More and more of our retirement residences are being reached out to by their local public health units to receive the vaccines for our staff and residents. But we still don't have that crystal ball. We still don't know when everything is going to go back to normal. So I know that a lot of you who are attending today's presentation are doing so because you've already done your research. Perhaps you were able to take a tour of our retirement residence in person in the past, or maybe you've taken one of our virtual tours recently, and you've made the decision that a retirement residence is what you need to live well and suits your lifestyle, but you're still delaying the decision to make the move because you're waiting until the pandemic is over. Here are a few of the common reasons that I hear people saying they want to delay the move right now. The first is the fear of congregate living. Due to the heightened risk of COVID-19, you're hearing everywhere you're safer to stay in your home. The second one is that you assume that if you move in, your family might not be able to come and visit you, and that somehow you'll be on your own during this process. A lot of people are afraid that if they make a move right now, their family and friends won't be able to help them with actual physical move to a retirement residence. And finally, if you do decide to make the move, a lot of people are worried about the 14-day isolation period and that you're going to be anxious and all by yourself during that 14 days. I understand how the pandemic and some of the assumptions that you may have made might be affecting your decision to make the move. Over the past year, we've seen a lot of news reports talking about congregate settings being unsafe, and even congregate settings outside of long-term care and retirement residences. When we're doing group gatherings with family and friends, we're being told that to be safe, we have to be alone. I don't think, however, that these accounts take into consideration some of the important measures that have been put into place in congregate settings like retirement residences, that retirement residences are very different from long-term care homes and that they experience outbreaks differently, and that some people may be at greater risk if they stay in their current living situation than they would be if they decided to make the move to a retirement residence now. I'm going to cover all of these points as well as some additional fears and assumptions that people might have later on in the presentation. So why are people saying that congregate living is unsafe? We know it takes interaction with other people to spread the virus, so by conclusion, this might seem obvious. But there are a lot of measures in retirement residences like Chartwell that have been put into place to ensure that our community settings are as safe as possible. At Chartwell, we've always maintained strong infection and prevention control protocols, but when the pandemic began, we enhanced our practices, and even in some cases, these were ahead of provincial and local health authorities. I'd like to mention some of them here and cover them in a little bit more detail. So the first is regular check-ins with our residents. We regularly check on our residents and inquire about how they're feeling and ensure that they're healthy and strong. This is a proactive touch point that helps ensure that we catch a sickness early if it's there, protecting both the resident with the symptoms and to help get them resolved as quickly as possible. Next, we have personal protective equipment readily available for our staff, all of whom are required to wear a surgical mask at all times. We're also encouraging our residents to wear masks when they're out and about and they can't maintain a 2-meter distance, the exception being in the dining room when they're enjoying a meal. For residents who are able to tolerate wearing a mask, this is a wonderful proactive measure, and we are encouraging them to do so if possible. We actively screen all of our visitors and staff each day, every time they enter one of our residences, to ensure that no one is presenting with any symptoms or feeling unwell, that they haven't been in contact with anyone who has symptoms or is COVID positive, and that they haven't traveled. We've also trained our staff on enhanced infection prevention and control and provide ongoing training and education materials for them. We've increased the cleaning and disinfection of our high-touch surfaces within our retirement residences. And last but not least, we're encouraging physical distancing and fostering safe social experiences for our residents while finding some creative ways to keep them engaged and feel together and optimistic. We're very proud that throughout the course of the pandemic, Chartwell has procured more than 5.7 million pieces of personal protective equipment for our staff, and we've hired over 5,900 new employees to help keep our residents safe. These are some things that you might not have seen in the news, so I thought that it was important to mention them here. Our residents and their families have been our greatest supporters throughout this pandemic and have shown their gratitude and appreciation for our staff in so many amazing ways. I wanted to share that Chartwell was one of the first retirement residences in Canada to survey our residents and our family members to learn about how we could serve them better during this pandemic and how they felt our response has been. We had over 13,500 residents and their family members participate in our Listening to Serve You Better survey, and the results really spoke to how safe our residents feel in their retirement residence, as well as the confidence the families have that they're being well taken care of and that they were in one of the safest places possible. While both retirement residences and long-term care homes have experienced outbreaks across the country, it is the outbreaks in the long-term care homes that you hear about on the news. So why is that, and what typically appears to make them worse in long-term care homes? I think it's important to discuss this point to help further distinguish between retirement residences and long-term care, and to help a loved one understand the differences, especially if the media has them a little bit confused right now. The outbreaks that we hear about most often on the news are taking place in dated long-term care homes, typically those with ward-style accommodations, and where there is a higher incidence of community spread in the local community immediately surrounding that home. Ward-style rooms in retirement residences do not exist, and in most cases, retirement homes offer private accommodations only. Another difficulty for long-term care residences is the prevalence of dementia amongst the residents is very high. Most often, people who are moving into long-term care homes do so because they are managing multiple complex medical conditions and/or advanced stages of dementia. Sadly, individuals in long-term care residences are at a higher risk of passing away from COVID-19 as these individuals are dealing with so many complex health diseases. This is why when you hear of people passing away, they're often in long-term care. They may often already be receiving end-of-life care, or they have a compromised immune system and simply cannot fight off COVID-19 the way that a healthy and strong individual can. As I mentioned earlier in the presentation, we're hearing constantly that the only way to be safe during the pandemic is to stay home, away from family and friends, and that's perhaps leading many of you to believe that you must wait out this pandemic until you can move into a retirement residence and might not be feeling as safe as in your own home. However, for some of you or your loved ones, your current living environment might not feel all that safe right now at all. For example, you might be feeling some of the following things while you're at home during the pandemic. Perhaps you're feeling uneasy or anxious at nighttime by yourself. You might be nervous that if you have a fall or a medical emergency, you'll be by yourself or not near a phone. I actually knew a woman once who told me that she left her front door unlocked all the time so that if she had an emergency or a fall, the paramedics wouldn't have to bust it down. This, of course, leads to a whole host of other safety concerns. You might also be feeling stressed that a third-party care provider, such as someone providing home care or meal delivery service, might not be able to show up on time all the time or might not be able to make it out to you due to inclement weather. With an entire staff of dedicated team members in a retirement residence you come to know and trust, you don't have to worry that someone is not there 24 hours a day, 7 days a week. Our staff are always on site, and they're not just there to respond to your needs, but they're there to anticipate your needs, especially during these challenging times. So the fact that you're joining this presentation today is likely an indication that your current living situation or that of a loved one isn't necessarily giving you everything that you need to live a happy and healthy life right now. In addition to some of the safety concerns we discussed on the previous slide, you or a loved one at home might be experiencing the following while you're at home. You might be feeling lonely or isolated as a result of not getting out very often. Perhaps you're not even getting out to the grocery store or the pharmacy or running some regular errands or seeing friends because you're nervous about being exposed. You might be feeling really bored, stuck at home without a purpose as each day kind of feels the same. It feels like Groundhog Day every day. You might be feeling very tired because you're exhausted looking after yourself or a loved one in your house and maintaining all of the day-to-day tasks as well as the cooking and the cleaning and the upkeep. On the other hand, you might be feeling tired because of a lack of activity because you're not getting out and exercising and doing some of the things that you did prior to the pandemic. You might be feeling stressed or anxious that you have to coordinate so many third-party services. We've got the snow shoveling and the meal delivery and home health care and pharmacy delivery and grocery delivery and all of these things that you need to coordinate. And if you're a senior, perhaps you're feeling a little bit guilty if you're having an adult child or a neighbor or a friend help you coordinate some of these services or run some of these errands on your behalf during this time. For a lot of us, winter has further exacerbated some of these things, making them even harder to endure. Living in a retirement residence where you can safely socialize with people your own age, experience leisure activities and fitness activities and benefit from those things, even if they're socially distanced, and take advantage of some of the benefits like housekeeping and dining and personal support services can all contribute to you leading a better life than you currently are during the pandemic and as well as afterwards. And even if you're already aware of some of these, you still might be delaying that move. Let's dive into some of the reasons that aging at home might not be an ideal situation for everyone, and in fact, prolonging the decision to make a move that offers you the support and care services you need could potentially have some long-term impacts on your health. Loneliness among older adults has been a hot topic of conversation for the past few years, and there's a good reason for that. Many studies have illustrated just how detrimental loneliness and isolation is to our overall health. I want to share with you a few staggering facts about loneliness among seniors and the health impacts. So up on my slide, you're going to see some findings from the Centers for Disease Control and Prevention relating to adults 50 plus who report feeling lonely. These studies show that social isolation significantly increases a person's risk of premature death from all causes, a risk that rivals smoking, obesity, and physical inactivity. Social isolation was also associated with about a 50% increased risk of dementia, and poor social relationships was associated with a 29% increased risk of heart disease and a 32% increased risk of stroke. Loneliness has also been associated with higher rates of depression, anxiety, and suicide. And among heart failure patients, loneliness leads to a 4 times increased chance of death, a 68% increased risk of hospitalization, and a 57% increased risk of admission to an emergency department. In addition to some of these shocking health outcomes associated with loneliness, you or a loved one could also experience negative health effects as a result of inactivity, both physically and cognitively. Poor nutrition, if you no longer have access to nutritious meals or if you're not preparing them for yourself on a regular basis. Medication mix-ups, if you've got some difficulty or your loved one has some difficulty remembering which medication to take and when and how often. And your house could be potentially a barrier due to accessibility or mobility, leading to an increased risk of falls. In a retirement residence, you can find immediate relief from some of these health risks at home, helping you to improve or maintain your quality of life and to help stave off some of those health or mobility challenges that can result from inaction. So some of these statistics I shared with you are kind of scary, and my intention is not to scare you here. I just want to underscore how important it is to have daily opportunities for meaningful socialization. Throughout the pandemic, we've seen this thrown into even sharper perspective as our homes and our residents and our staff have been paramount to helping each other get through this tough time. Going through this time together has been a real bonding experience for our residents and our staff in our communities. We've seen staff supporting residents, but even more than that, we've seen residents supporting and reassuring our staff. That's because everyone knows each other, they care about each other and their well-being. In the early days of the first wave, when there was that initial lockdown, I heard stories of residents calling on each other or knocking on doors just to check on each other. We heard stories of our staff pulling together personalized care packages of goodies and delivering them suite to suite, or going up and down the hall with the mobile happy cart hour, or just putting together some musical entertainment outside to keep our residents engaged and provide a little bit of fun in their day. We heard stories of family members dropping off donuts and pizzas and coffees and gift certificates to our staff to say thank you and just how appreciated they are. You have no idea how tight-knit our communities are until you visit them or work in them or live in them. Having that strong sense of camaraderie has had real tangible health benefits and contributes to overall individual resilience, which is so important to have during these adverse times. In fact, research shows that living in a supportive community can help people of all ages cope through uncertain times. They have better individual responses, they adapt and recover from adverse effects quickly and more efficiently. For example, social connection and engagement is linked to better physical health and stronger immune system response, as well as improved mood and a lower risk of dementia. We have a real sense of belonging, also reduces the risk of mental health issues, it lowers the heart disease mortality, and contributes to better overall health. And all in all, having that strong sense of resilience just leads to better mental attitudes. Right now, our residents are in a way socializing from a distance. So we're trying to respect our public health guidance, but it's still really important to make sure that our residents have access to great social experiences on a daily basis. In a retirement residence, you may have many opportunities throughout the day to socialize when you don't want to be in the privacy of your own suite. So this includes meals in the dining room, safe and socially distanced activities, including charitable initiatives that offer residents an opportunity to give back to their local communities, and provides a strong sense of purpose, and enjoying some time outdoors. It's likely a lot more than you might be experiencing in your current home or the home of your loved one. So let's talk about some of those other fears and assumptions that might be holding you back from making a decision to move into a retirement residence. The first one is, can my family visit me once I move in? When the pandemic first began back in early 2020, one of the measures that was put in place by public health and provincial authorities was a very strict no visitor policy to retirement residences. So even if the residence was not an outbreak, we still weren't able to welcome visitors into any of our homes. That restriction was certainly difficult for many residents and their families, but I'm happy to say that governments have learned from that experience and realized it was detrimental to the health and wellness of our residents to impose that across the board. So retirement residences do allow visitors now under different circumstances and measures depending on where you live. So for example, depending on the province and the pandemic restrictions, you might see things like the number of visitors per resident capped at a certain number, or resident guests are required to wear masks at all times. In some cases, visits have to take place outdoors. And in some cases, if there is an outbreak of COVID-19, but the family member is deemed as an essential caregiver, that family member could still be able to visit a residence even if there is an outbreak. The next question we have is, will I be able to have help from my family and friends to move into the residence if I was to do so right now? Moving and downsizing can be an overwhelming and daunting task at the best of time. So I understand why this would be a concern if you're thinking about making the move to a retirement residence. This is not the case at all right now. We do have a safe move-in process in place that has the flexibility of family members to be present on the move-in days and the days that follow to ensure a smooth transition into your new home. Our priority is to keep you safe and help you feel at home so you can trust that you will not be left alone in this process and that we're going to be available to help you with all of your options and support decisions. And then finally, if I must isolate for 14 days, will I be all by myself? Some provinces, such as Ontario and BC, have mandated that new residents moving into a retirement residence must isolate in their suite for 14 days in order to prevent the introduction of the virus into the broader community if someone unknowingly has it or it hasn't shown up on a test yet. So in order to help you feel at home and supported during those first 14 days, Chartwell has created a program called Transition Together. And this introduces daily touch points with our staff and residents with people who are isolating in their suites. So when you move in, we're going to provide you a calendar that shows what you'll be doing each day to help welcome you to your new residence, from one-on-one activities with staff members in your suite, to specialized delicious treats delivered to you, to family visits, to introductions to fellow residents with whom we think you might share some common interests. It's a safe process that lets us satisfy the public health requirements while also helping you settle into your new home. So lastly, one of the things that we hear quite often is that people don't want to make a move into a retirement residence if they've never even visited the home or been able to take a tour and see the suite and the dining room and all the accommodations. If you don't feel comfortable coming in for an on-site personalized tour, or if your province has temporarily restricted tours due to COVID restrictions, then I want to assure you that we can absolutely accommodate a tour for you virtually. Our retirement living consultants are well trained and practiced at using technology to show you around the residence and the suite that you're interested in, giving you the opportunity to ask questions, to meet staff members, to meet fellow residents, and to guide the tour through any area of the property that you would like to see. So I can understand that you'd want to see what you're buying, and I want to assure you that we can absolutely make this happen for you. So I've provided a lot of information, and I understand that you likely have some questions. Before I start to answer some of the participant questions that have been submitted through the chat, I want to mention that for those of you who have just begun to explore retirement living at Chartwell and you're ready to learn more about the lifestyle and how it can help you or a loved one, we have a team of knowledgeable representatives who are able to answer all of your questions and guide you in the right direction. So you can either call us or you can email us at contact@chartwell.com anytime. And for those of you who've already been actively researching retirement living, perhaps you've already taken that in-person or that virtual tour, now is the perfect time to get in touch with your retirement living consultant and to ask another question or to have a follow-up conversation. I do want to encourage you to do this sooner rather than later. Take full advantage of this time to ask all those questions, do your research, meet the staff on a virtual tour, and consider scheduling your move-in. It's also a great time to start thinking about some of the move-in processes and ensuring that all of your financials are in order. And in fact, if you're still exploring if you can afford retirement living, we actually have a fantastic webinar coming up on February the 25th with financial expert Kelly Keene, who will be available to answer all of your questions related to finance and affordability in retirement living. So with that, I'm going to turn things back over to Steph, and we're going to handle some of your questions that you've been submitting through the live chat. Steph?
Thanks, Amanda. That was a great presentation. Now, before we get to questions, I want to remind you all of next week's webinar entitled Navigating Your Care and Support Options. You know, so many people get confused by the care services and options that are available to seniors. So if you're debating or trying to understand the differences between home care, a retirement residence, and a long-term care facility, we will try and demystify it for you next week. So now, if you look up on the screen, you'll notice how we have different times for next week, and that's because the healthcare systems in each province are very different. So register and join us on Facebook Live and YouTube Live at the local time indicated for your province. So with that, let's get to some questions, and just give me a moment here. I'm going to unshare my screen. And then we're going to take a look at some of our first questions. Okay, our first question is a great question. Question that so many people are asking right now. What is Chartwell's rollout strategy for the vaccine? So I think I'll turn this one over to Amanda to answer. What is Chartwell's rollout strategy for the vaccine?
Thanks, Steph. That is a great question. So, as I mentioned earlier in the presentation, provincial governments and public health units have prioritized our staff and our residents to receive the vaccine before the general population. So we're hearing more and more of our residents being reached out to by public health or the hospitals to get vaccinated, which is really exciting for us. It's really wonderful to see that our staff are making these vaccine clinics and exciting for our residents, right? They're partying, they're showing them just how excited they are to get that first shot and then that second dose. It's really exciting for us to be among the first of the population in Canada to be receiving protection from COVID-19. So we're thrilled for our staff and our residents. Regarding our specific rollout strategy, while we're strongly encouraging all of our residents and staff to opt into the vaccine when it's offered to them based on advice from public health, and we're offering a lot of education about the vaccines for our hospitals and local health units. They're the ones that determine who gets the vaccine and in what order. It's not Chartwell itself that makes these decisions, but we are encouraging everyone to get the vaccine.
Great. Thanks. Thanks very much, Amanda. Great answer. So I'm scanning through our questions here, and the next one is, are residents allowed to leave the residence during the pandemic? Great question. Are residents allowed to leave a retirement residence during the pandemic? Now I'll turn this one over to Amanda as well.
Yes, so absolutely our residents are allowed to leave the residences during the pandemic. However, in neighborhoods where there is a high rate of community spread, and during times like this when the pandemic is at its worst, we are strongly discouraging our residents from leaving the premises to visit with other people. Just like ourselves in our own homes, we're asking them not to go out, but if they do so, only to do so for essential reasons like grocery shopping or medical appointments, maybe going to the pharmacy, or simply to get their exercise in, get outside and get some fresh air.
Great. Awesome. Thanks, Amanda. Great answer. Looking at our questions here, are you still offering all the services you normally would be during the pandemic? Actually, Amanda, I'll take that one. Generally, yes, although some services have been adapted according to the situation, obviously. So activities, for example, we normally would have, parties and entertainers and events, bus trips to the museum. But of course, we can't do those things right now because of public health restrictions. But we still have lots of activities and fitness sessions in the residence. But naturally, we're following physical distancing, protocols, smaller groups, and our staff's definitely using their creativity to make them all enjoyable. One thing I want to make note of is that it's our care offering and services have not been impacted by the pandemic. We are still delivering fully on that part of the equation. And one thing I could also say is that our residence care staff get to know their residents very well and understand their needs and preferences, whereas this is not always the case when dealing with home care employees. So we're really happy that we were able to continue to be able to do that throughout the pandemic. So let's get to another question here. Okay, here's one. My mom needs a lot of care, and I'm nervous about that because I imagine that that means she'll have more one-to-one interaction with staff. What measures are in place to protect residents who interact closely with staff often? So that's a great question, and obviously that's a big concern based on everything you hear in the news these days. Of course, our staff are following all public health guidelines for PPE. And in one-to-one care situations, we're even asking our residents and ensuring our residents wear masks if and when possible. All of our care staff are well-trained and know all the proper procedures for sanitizing and protecting themselves and our residents. So I think we're doing a really excellent job in this regard and doing everything we can to keep our residents and our staff safe and secure. So I'll get to another question here. Okay, here's a great question for Amanda. Maybe we'll close on this one because I think a lot of people are interested in this. What is the best piece of advice you'd give to someone considering a retirement residence right now but wants to wait? Great question. Best piece of advice you'd give to someone considering a retirement residence right now but wants to wait? And I'll hand that one over to Amanda.
I love this question, and I think that there's two things that you could do right now. So the first is use this time to do your research. If you haven't started the conversation with family or friends who are involved in the decision, then start it. Now is a perfect time to do so. It's also a great time to reach out to the local Chartwell in your area and speak to the retirement living consultant. They can help you get all of your questions answered and sort of help you get all of that research done now. The second thing I would say is don't wait for a crisis. Steph mentioned at the beginning of the presentation, I've been in this industry for 15 years, and I don't think I've ever experienced a time when someone's picked up the phone and said, okay, I'm ready today. Typically, we receive these phone calls because there's been a health concern, a crisis. Someone's fallen and broken a hip, or they've gone to hospital, or something has happened, and all of a sudden you're forced into making a snap decision. And so, in those circumstances, you might have less choice as to where you go. You might not have all of the information about all of the homes that you wanted to have prior to making a decision. So, don't make yourself get into that situation where you might be rushed and you don't have time to shop around for the retirement living options that you're considering. So, if you don't want to make a move right now, it is still a great time to do some research and better understand your options.
Great answer, Amanda. Thank you so much. So I know we have a number of other questions that are coming through. A lot of them are one-off types of questions, and we're going to actually be responding to those individually on Facebook or YouTube Live. But I'd just like to say a couple of things right now in closing. One is that these presentations will be available on our Facebook Live page and YouTube Live page going forward, so you can review them at any time. And I also like to say that I'd like to share a video with you right now featuring a Chartwell resident, Marion, who discusses her experience at her retirement residence during the pandemic and why she believes she lives in the safest place possible. Have a healthy and happy rest of your week. Thank you so much for joining us today, and take a look at this great video.
Well, people say to me, I would never live in a retirement home. I wouldn't. I just wouldn't live in one. And I said, well, you're very much mistaken, because that's the best place you could be, especially in COVID. It's the very best place you could be. I'm Marion. I live at Chartwell, and I've lived here for about 2.5 years. Here, you've got all this help around you. You know, you don't have the responsibility of making sure that your world is safe, because it is here. If I were still living at home in the COVID, I would be in danger, I think, because I would be out in a car driving, I would have to shop outside, I would have to cook, I would have to do all the things that you would normally do in your home. I think by living in Chartwell, that this was the safest and the very best and finest place that we have chosen to live in.
When I'm at my work, I feel my safest. I know all the procedures and policies that we have in place is going to keep us safe. On a daily basis, we would be doing high touch point areas, door handles, grab bars, by the reception area. So we're wiping them down 3, 4, 5 times a day. We're just fighting it as a team. Once everyone's on board, it makes it a lot easier for the residents and makes them feel a lot more safe. A lot of them watch the news every day and they see the numbers, but that's not reflected in this home, which is a real blessing.